Welcome back. I hope you're doing good till now. Wonderful. You have survived. All right. So now we are going to discuss about two joints or two components. One is shoulder and the other one is scapula. Okay. This is basically one component altogether, if you will see, because one cannot function without the other efficiently. Otherwise, they keep on getting trouble. All right. So first, let us discuss the shoulder. So what is shoulder joint? You remember what I told you about the elbow, right? The liberation. So this is your humerus bone and this is your scapula. All right. Scapula, humerus. Keep them away. No shoulder. Shoulder is liberated, right? Okay. So joining together, they form shoulder joint. All right. So when we talk about shoulder joint, it is a very complex joint, I would say, because first of all, it is a ball and socket joint, means the ball, that means the humerus head, is inside the socket, which is the socket of your scapula, right? Forming here. So we call it a socket here. So the scapula, coracoid process in the front, abdomen process on the top. So it literally creates a kind of cave inside wherein your socket can sit and can move easily, right? So ideally, it should be centralized and keep moving in all directions freely. So problem happens whenever this happens, right? Any side. So whenever it is stuck anywhere, it creates problem. And that is why people are having pain, right? So whenever you're having pain in a shoulder joint in moving in any direction, everyone can have pain in different directions, right? Because shoulder is a very complex joint, which is basically, I would say, anchored from all the sides from different tendons and muscles, right? Definitely tendons, right? Tendon reaches to the bone, right? And connects the muscle to the bone, basically. So it is connecting. So in a layman term, we say that all the muscles from all the way around on the top, right? In the front, to the side, from the back, from the bottom, from everywhere, there are certain muscles which are coming and joining on your humerus bone, right? And this is how they are defining how your shoulder or how your humerus bone should move. So whichever muscle will be dominating there will be creating what? Some dysfunction, right? Because it is not working as a team. Some muscles are working or dominating, some muscles are not even working, right? So we call it, right, something which is not working, which is inhibited, right? And something which is overworking, dominating, right? So basically, we will go through this in your theory. Already, I hope you have gone through the theory in the manual. Here, we will just understand how this concept work together, all right? So when you say in yoga or in general, when you see the movement of his shoulder, it does a lot of movements, isn't it? It's a ball and socket joint, almost can move freely everywhere. It is flexion, it is extension, it is abduction, abduction, adduction, addition means abduction, coming closer to the midline of the body, right? And then it is external rotation, internal rotation, right? And then it is circumduction, when you can move it everywhere freely, right? All right. But this higher mobility comes with a cost of injury, because anything which is highly mobile is less stable, right? Something which is less stable is easily prone to injury. And that is why shoulder joint gets injury very quickly like this. Even if you're a yogi, you're a sports person, or whosoever you are, you may get injury. Even if you're working too much or you're not working at all, you will get injury here with time, okay? Sometimes people get the injuries due to immobility, right? And suddenly they are moving and then injury, right? Or restriction, you must have heard of, frozen shoulders and all these things. What are these terms? These are terms that when you're not utilizing your shoulder enough, right, in your day-to-day life, and then slowly and gradually, what is happening? The mobility, you're losing the mobility there, right? Similarly, people who are moving a lot, right? Some sports people, some yogis who are moving their shoulder in every direction, right? Without even knowing that how much, what is the limit, right? So when you're doing like that, then in that case, you may get injury. So it is very, very important to know your shoulder joint, the right way to, move your shoulder joint, your humerus, your scapula together. They both move together. So you should be respecting each other, right? When you're moving, right? So we will see that how in yoga. In yoga, as we know that mostly we see the flexion movement in yoga. This moving on the front, right? Here. So in the flexion, if you will see, you do downward facing dog, or you just raise your hands up, or you're doing up handstand, whichever movement you are doing, you're loading your shoulder there, right? When you're loading your shoulder there, you should be aware of that how much range of motion you already have in the shoulder. All right. You will be doing the testing and assessment in the course for sure, or you must have done already. I know. Maybe. If you have not, then you will. Your mentor will take you through. But here, the thing you need to say is why and what happens when we are going here. So when we are going here, one of two things can happen. When you're moving your arm like this, it gets stopped from accruing process right here. So in the manual, you have the pictures. We have the 3 type of accruing processes there. You just watch those pictures, that how the different shapes, how the range of motions, how the less space or more space can create a lot of differences in your accruing process and your ball of humerus, how the relation between these two can give you more range of motion or less range of motion. So you need to just understand this. The accruing process is a roof. It is a roof of your shoulder. Okay. This is the floor of your shoulder. And whatever comes in between is a furniture. So if the roof collapses, what will happen to the furniture? You know it, right? Similarly, if the floor goes up towards the roof, again, what will happen to the furniture? You know it, right? Similarly, what will happen inside with whatever structure you are having here, it may be muscle, it may be bursa, it may be fascia, it may be nerves, it may be tendon, can be anything there, right? So what will happen to those structures when any of these will come together in contact? Definitely they will cry, right? And that's what is happening, crying, isn't it? So we just need to make sure that how to know that what is happening there. Okay. Second, when you raise your arm up, you get in contact with the accruing process right in the front whenever you're going. Okay. If you want to avoid this contact, you may just go a little bit outside and then you can go easily behind because you are not getting in contact here. But now, more mobility, remember, less stability, because whenever you're going like this, that means you're moving out of the socket. And whenever you're moving out of the socket, what will happen? Now it is no more giving any stability. That means if there will be a lot of force and if you do not have any enough strength there, dislocation can easily happen. So you must be knowing dislocation, right? Shoulder dislocation, it may happen like this. And then in the manuals, you can easily see your mentor will tell you how to engage the muscles in these cases so that you don't get any injury in the shoulder joint, how to use the scapula in relation with the shoulder joint so that you don't get any severe injuries in yoga, in sport, or in any other kind of movements. Even if you are doing some push-ups, how to do the push-ups even, right? How to do the chaturangas, how to do the wheel pose, how to do the downward dog pose, right? So everything you're going to go through, how to do any exercises like pulling movements in gym, in the machines, right? Sitting in the machines. So you will get to know everything in the theory part. But here, just watch a couple of things more. That when it comes to scapula now, here in relation to the shoulder, they both move together to give you full 180 degree of range of motion here. Without the help of scapula movement, your arm will not be able to go up, right? It will stop it. And that's what happens in frozen shoulder cases, that people are unable to lift the hand up. Why? Because scapula is not moving or the joint is so rigid. All right. So we need both movement together. All right. So when we talk about scapula, you will learn in scapula, maybe you have already covered it. So just watch here. And if you have already covered it, or if you haven't covered it, you will be going through two wrong type of movements in scapula, which you don't have to perform if you don't want any injuries, right? And again, two movements which you need to correct so that you get stability in the scapula. All right, stability in the scapula. Once it is stable, it can move freely. If it is not stable, it will also keep on tossing and turning anywhere, and then they will be keep on banging on each other. Right. So you must be knowing this, the simple philosophy of movements that if you want to move, first get stable, because without stability, if you will be moving, you will fall. Okay, so it need not to be static stability, but dynamic stability. That means, yes, you are moving, but you are stable in the movement. That is called dynamic stability. You're moving, but you are aware of your movements. Okay, you know that which muscles to engage, you know that how to keep what joint where. So dynamic stability. So you are moving, but you're stable. All right. So when you're running, when you're playing, when you're doing anything, you are doing with dynamic stability, basically. All right. In yoga also, whenever you're moving with dynamic stability. Most of the part in yoga, we do static stability. But then whenever we are moving, like in strong yoga, right? Whenever you're doing any power yoga, whenever you're doing any flow type of yoga, whenever you're moving faster on the mat, you're doing dynamic stability. Okay, with the movement. Cool. So here, in this case, the scapula. When we talk about scapula, scapula is a combination, if you will see this, we call it shoulder girdle, basically, complete, right? So here in the front, you have the collarbone, clavicle coming here, and then it is here attaching with the help of little ligament here. This is acromion process, which is coming out from the spine of the scapula. Can you see this? This is the spine of the scapula, right? The spine of the scapula. From here goes your supraspinatus muscle, right here, behind, okay? Here on the rear side, you have infraspinatus. In the front inside, you have subscapularis. And then on the side, you have teres minor. And teres major is also here, right? So we call it 6 muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. So combining all these 4 muscles, we call it 6 muscles, or we also call them rotator cuff muscles. So whenever you get any rotator cuff related injuries, you must have heard of, we are talking about these muscles only, that any of these muscles get injured, right? Maybe get tear, maybe smaller, minor, or maybe major, right? So you have to take care of it. And why it happens, I've already told you, whenever the scapula and the humerus are not functioning in combination, they're not stable, and then it is too much mobile, then you may get injuries, right? All right. So in scapula, we have certain movements that we will see now. So in the scapula, what we have? Elevation, that means going up, depression, going down. So that means keeping the shoulders down and not here. Elevation, depression. Then we have protraction, like it's a big hug. You're hugging someone. So the scapula goes like this when you're hugging someone, outside and then away. Okay, so outside and away. So it's a combination, out and away, out and away. Retraction, coming in and in. Okay, like it was going out, so it is coming in now, and then in, because it was going out in protraction, coming in and in. Okay, retract. Okay, to keep it together. All right, and then after this, we have movement, upward rotation. Upward rotation is the movement which I just showed you, the flexion movement. When you do the flexion movement, it is moving upward. That means if it is here, let's say, and you're moving up, so what will happen? It will go like this, little bit. Not everyone can, because not everyone have that kind of mobility in the scapula inside. But yes, it should be. If it is here, it should go back. If it is here, should go down. So if it is going like this, it is downward rotation of the scapula. That means it's going forward. So you must have heard of term called kyphotic postures, right? In kyphotic posture, in older adults, you will see easily that people tend to get, rounded spine on top. It is due to kyphotic. And what is happening there in that case? The scapula is moving like this. This is downward rotation of the scapula. And then when you move back, roll the shoulders back and down. It is upward rotation. That means you're bringing it up and back. Okay, not forward, right? So these 6 movements are there on the scapula, and your mentor will also tell you one more movement in the course, that what happens with the help of the humerus. Okay, the 7th movement of the scapula. You will learn in the course, right? How you can utilize that movement. Again, not everyone will be having that movement. It is individual to individual basis, because everyone have their different mobility in the joints, right? Fruitful in certain cases, not so fruitful in others. So you will get to know that, because everything comes with a cost. Remember, okay, nothing is free in this world. So if you have too much mobility, there is a cost. If you don't have, there is a cost. Okay, so too much of stability is having a cost, too much of mobility is having a cost, and samatvam yoguchyate is something which is prescribed, right? In Bhagavad Gita. So balance, equanimity in all the actions is called yoga. So just find the balance of stability and mobility for the healthy living for yoga, right? So you will get to know the 2 movements in the course with your mentor, that what 2 movements, the wrong movements of the scapula, which can lead to shoulder joint injury. All right. You will get to know about the lurching of the scapula in the course, and how to avoid the lurching using the scapular movement. So we are going to use the scapular movement to prevent the shoulder. Basically, we are going to use downward rotation or depression movement. We are going to use the upward rotation movement. We are going to use the retraction movement. We are going to use the protraction movement. Okay, so we are going to use almost all sort of movements of scapula to prevent it time to time. So it is not always that your scapula will just keep on sitting like this or keep on staying like this. No. So we just need to always keep on moving it according to the shoulder. Okay. Or shoulder will move according to the scapula, vice versa. Okay. That you will learn in the course. All right. So bye-bye until next time. So after this, I will see you for the next joint. Until then, keep practicing your shoulder and scapula. Bye-bye.